Welcome to Maynooth. My name is Ronan Farrell. I'm the Dean for the Faculty of Science and Engineering, and I'd like to welcome you to Maynooth University for this event. It's been organised by ourselves in partnership with the Kathleen Lonsdale Institute for Human Health. It's hard to believe that it's been nearly 2 years since the first report of COVID, which was December 2019. And from those early days, scientists were asked to give their opinion on what was a new and unusual virus. And I would like to say that over the past 2 years, a number of prominent scientists have bravely stepped forward and engaged with the media to educate the public on what the virus is, how it spreads, what are the treatments, and what policy changes we could implement to control the pandemic. And it wasn't without controversy. And it's not to say that the opinions were always consistent. It wasn't to say they didn't change over time. Science kept evolving, or knowledge kept evolving. Well, I think it'd be safe to say that we were all greatly enriched by those conversations and the bravery of those scientists. This evening, we are joined by what I'd say two of Ireland's preeminent immunologists, Professor Luke O'Neill from Trinity College Dublin. I think we all know him. We're also joined by Professor Paul Moyna, or Professor of Immunology here at Maynooth University, but who's also the director of the Kathleen Lonsdale Institute and also head of our Department of Biology. So he's been fairly busy over the last 2 years, and he will be participating and chairing this conversation. We're also joined by one of Ireland's best-known broadcasters, Dr. Ciara, a GP, an award-winning columnist with Life magazine, and a radio broadcaster with Newstalk. And I'll say personally, I enjoy your show every morning. I would also, I really do appreciate the time that Luke and Ciara are giving us this afternoon, or this evening, and also being willing to come here on campus in person. As a university, we're very proud of the role Paul has played over the past 2 years. And so, for those of us in the community, we know he's been focused on making sure the students get their education, getting the labs, continuing the research on COVID and participation with SFI, and also participating in the public domain. I also would like to thank everyone who's here today in person and those of us joining us online. For those in the room, we would like to welcome students and teachers this evening from Maynooth Post-Primary School, Salesian College, Newbridge College, Eureka Secondary School, the Dunboyne College of Further Education, and members of the Irish Science Teachers Association and the Institute of Guidance Counsellors. You're all very welcome. Before we start, I would just like to thank the people who made this possible, to Paul, who took lead of this event when we came to him. He made all the connections, and he ran with it, and without whom this would not have been possible. I would like to thank Ethan McGuigan, our Faculty Promotions Officer, and Dr. Nazira Delajic of the Kathleen Lonsdale Institution, who organised everything meticulously. I would also like to thank Campus Services, the Campus Gardaí, and to all our postgraduate ambassadors who've been helping us with our COVID checks this evening. So, thank you. I think it's going to be a really enjoyable conversation, and at this point, I'd like to hand over to Paul.
Thank you very much, Ronan. Welcome to you all here in person and online, and especially welcome to Ciara and Luke. So thanks very much, guys, for joining us here today. I suppose the idea here is to have somewhat of an informal chat, conversation around the importance of science, the role that science has played, many achievements of science during the pandemic. Over the last 2 years, I've spoken to both of you quite a lot, and I think what's things you both is in terms of, you've given your views, opinions, expertise, and what I'd like to try to do is maybe probe some of the areas that maybe hasn't been sort of probed in very much detail, and look at science. We hear that follow the science phrase that's used all of the time. Have we followed all of the science? Has the science always been there? Have there been occasions when we've had to move before the science? So just to tease out some of those things and get your views on them. So Ciara, I'll start off. So again, thank you for coming. In terms of your broadcasting presence, you're at the interface there in terms of policy and communicating that. to the public, but also your medical background as well. I think gives you a unique perspective in terms of, obviously from you being a GP, but also I think you get to appreciate the impact this has had in patients, their families. So I think when you comment on things, you bring a number of different perspectives to this. So in terms of, from your broadcasting perspective, how important do you think it has been in terms of communicating science to the public? Do you think that is an important aspect of understanding, you know, some of the achievements of science and communicating that to the public?
I do, and thank you for inviting me here this evening. Absolutely. I mean, COVID has dominated the news agenda since the first. You know, we were hearing about it from maybe the end of 2019, but it has certainly dominated the news agenda here in Ireland since we had the first cases in February of 2020. You know, a handful of days, I would say, since then have gone by that we haven't had a COVID story in the news. It hasn't featured. And obviously, certainly, lip service at the very least is paid to following the science and following expertise and getting people on, you know. I think there's a definite desire to have the right people on as guests and the right people communicating with the public and all of that people don't want to have, you know, crackpot ideas aired or things like that. So there's a definite desire to communicate science effectively, but it's very easy in a way for us who you know, you guys are immunologists, I spent 20 years as a doctor, as a medical doctor. We fall into shorthand when we talk about this stuff without even realising it. So I think there still is a bit of a shortfall in how well, despite people like Luke who are great, and yourself who are great at doing it, I sometimes think there's still a shortfall in our ability to communicate some of the complexities, because you know, social media is a huge beast in all of this, as well as mainstream media. And of course, social media likes to keep things very simple and simplistic, and it's not simple. It's been complex from the beginning. There are nuances, there are subtleties, it changes all the time, so the narrative changes as well. It's been a very dynamic and fluid situation. So I think there have been many shortfalls in our ability to communicate effectively the science, and also there is a sort of maybe not an information deficit, but maybe an understanding deficit sometimes in the people that we're communicating the science with, because not everybody has even a basic grasp of science, and where they're talking about, you know, proteins on the surfaces of viruses and antibodies and all these things. And we say those things as if everyone knows what an antibody is, but not everybody does know what an antibody is, and we don't always maybe explain it as well as we should. But it has been a very difficult environment, and I would also say, as somebody who changed horses and went from working in medicine to working in broadcasting, is dare I say it, that people who are in the media, their understanding of it is relatively limited too, and they're used to more simple stories about, you know, something to do with politics or something to do with the legal system or something, and this is a bit different. And so there's an awful lot of people out there, I would suggest, spoofing a little bit, and that's kind of how the media works, whether we want to admit that or not, but having gone into it, I now know that it is. And so it's been difficult and it's been challenging, and I think on balance we've done okay, but we could probably have done better.
I think we'll come back a little bit later on to that, Ciara, in terms of the various forms of media and, you know, the role of mainstream media, but also social media. So generally then, Luke, from a science perspective, you sort of as like a key scientist within the country, what has struck you in terms of, you know, the major scientific achievements, and also in terms of the speed of some of these developments, which in some ways is unprecedented? We're looking at things ranging from testing to being able to detect variants, to, you know, vaccine development, to now new antivirals. What has sort of struck you there in terms of the major achievements, but how a lot of this has been achieved within a remarkable time frame?
I think we got lucky, Paul, actually, you know, because there was no guarantee the vaccines would work, remember? Coronaviruses are notoriously difficult. We keep catching them every winter, and it is a coronavirus. So the fact that we got those vaccines so quickly is just a relief to all of us, really. And then the technology behind them had been worked on for 10 years or more, as you know, especially the RNA technology had been tried before. So the fact we got them is fantastic news, and the fact that the science behind them was so powerfully compelling, in spite of what some detractors say. Remember, 40,000 patient trial was done with that Pfizer vaccine, the biggest clinical trial ever run for any disease, as you know. So that was an amazing achievement for Pfizer. Now, they were given loads of money by the US administration, of course, to help them. as have all the companies, mainly been subsidised by the taxpayer. But the achievement was remarkable to get to that point, as you know. And to get 95% efficacy in your first trial with anything is remarkable. So we're all relieved by that. The second big achievement is definitely these antivirals. Now, again, they've got to prove themselves. There's still clinical trials data. We haven't seen the papers yet, but from what I'm hearing, they're as good as they say. They will be a hugely important weapon against this virus. And they're very difficult to make, by the way. In fact, again, they got a bit lucky there. It's very hard to make an antiviral that's not toxic, because you're hitting a piece of the virus that isn't in your body. Because if you hit something in your body, you might get sick and there'll be side effects. And many antivirals fail because of toxicity. And with HIV, as Ciara would remember, they're very toxic drugs actually often, you know. So the fact that we got these two antivirals that seem to be safe and very effective at decreasing hospitalisation is a huge achievement as well. And that was very strong biochemistry, as you would know, Paul, because it's a protease inhibitor, Pfizer. They're hard to inhibit at the best of times. They had a track record with hepatitis C and HIV with protease inhibitors already, so that helped them. The molnupiravir is a transcriptase inhibitor and introduces errors. So very strong science behind them, you see. So to me, that's obvious, because these are the two biggest benefits we're going to see from this. The third thing will have to be mentioned, and that is testing. They got the PCR quickly, that was easy. And then the dreaded antigen testing, which we've been banging on about for 15 months now. That's a great achievement, remember, because to get a specific antigen test that's as reliable as the ones that have been, now there were dodgy ones out there, of course, but the ones they've picked are fantastic tests. I mean, they're very robust. So they're the big scientific
And how do you think we condense the time frame of, like, previously to develop vaccines, the quickest things were months, it's around 4 years.
Yeah.
But typically it's around 10 years.
Oh yeah,
So
10, 15, 20 years.
How do we condense that down?
With failures, remember. I mean, they've been trying to get a malaria vaccine for 30 years and failed, you know. Now they're getting closer lately, of course.
And the same with HIV. And
There is one for HIV still, which is in Hep C. They tried that, they couldn't get one against that. Now, obviously, these are different viruses and they've got different rules. The game is different for each virus. So, but I was a bit, I didn't say it in public, mind you, but I was a bit pessimistic because coronaviruses through history have been very difficult to deal with.
Yeah.
I mean, the four, as people probably know by now, there's 7 coronaviruses, and this was number 7. There's 4 others that just cause the common cold. They tried for decades to get ways to treat those and failed. And you catch a coronavirus every winter. So in other words, you don't get immunity from coronaviruses. And that's still a challenge with the waning issue now, by the way. You know? So that's in our minds at the moment. So we're still in the thick of it, remember. The best data we've got in the last 6 months is this Israeli data on the 3rd shot. They're exceeding the efficacy of 2 shots now, the 3rd. So it will be a 3, possibly 4-shot vaccine in the end. You know?
yeah. Can I ask then, sort of from a personal perspective, your experience over the last year and a half in terms of communicating that science and being out there? So, Ciara, for example, and you know, you've given your views and opinions on policy, and how have you found that process? And like challenging? And
It can be challenging because you say if you're going to be true to what you actually think, at times we'll probably say things. You know, I'm not a politician, so you might say things that wouldn't be populist or that wouldn't be sort of popular sometimes, and there's always a pushback. We were just discussing before we started talking here about the fact that, you know, my workplace, which is a media organisation, you know, we're getting threats from anti-vaccine groups and organisations because, you know, we're quite pro-vaccine and all that. But, you know, there's been so many waves of this. I don't even just mean the waves of the virus. I mean the waves of how we've thought about the virus and how we've talked about the virus. And it's funny, I remember when we went into lockdown 2, which was sort of last autumn, and it was I was quite against lockdown 2, or I was deeply concerned about it because it was exactly as you say. We didn't have vaccines. I was also privately quite pessimistic about vaccines, going, how are we actually going to do this? And what if we don't get them? We just go into lockdown, we just stay in lockdown. And we were seeing all this sort of cumulative effect on non-COVID related healthcare without really an end in sight at the time. It all changed around the new year when, you know, in December we started rolling out vaccines, and that was good. But it was so fast, but we didn't know it was going to happen. And, you know, I was very keen that we would have locked down in lockdown 1. I would have probably locked down ahead of when we did, but I was much more cautious and concerned about lockdown 2 because we were at different, I suppose, stages in the pandemic, and at different times, you know, and you have had hassle as well. You get a bit of blowback if you're going to say things, because people, it's a slightly, to use a a fevered scenario at the moment, because people were very anxious, people were very worried, people were afraid, people were in hospital, some people had somebody who maybe had died, a loved one and things like that. And that added a heightened sort of sense of anxiety and anger and fear to the debate. So the debate at times was not rational, not very well informed, and more sort of fear-fueled than I suppose anything else. And so there was times when you were commenting, or when you were involved in the conversation, or writing, or speaking, that you know, it wouldn't go well personally. You'd get like abuse or whatever. But that's, you know, I live a lot of my career in the public eye, and so that's a kind of a par for the course thing to some extent. And if you're going to not speak your mind, or indeed adhere to what you actually think is correct, well, then you're not doing your job properly.
And how did you find it, Luke? So obviously Ciara's mentioned as public figure in some ways.
Well, Luke
so prior
is
to
now
Bring it on, bring it on.
So prior to COVID, obviously, you know, you've done your weekly science programme.
Yeah, but
that's
nobody
changed-
listened to apparently.
changed quite a lot.
I listened to it.
People say to me now, I knew you before you were famous. You know?
Nerds like me listen to you.
Ciara was a fan. I must give you credit for that. Ciara encouraged me sometimes. But I
People
don't do
know
the
you
fan.
as a musician now, Luke. They don't actually know
Well,
you're a scientist.
well, myself and Ciara,
You're actually a
remember, we were,
scientist.
Ciara's a metabolic.
Yeah.
I could talk for all night about this in a way, because it was a bit of a surprise to me. I always like to be a politician. That's the first thing that struck me, right? This is what politicians get the whole time. They get attacked, they get abuse, they get people outside their houses. It's a horrible reality of current times that we live in. And that began happening to me. I didn't quite expect it to be so malevolent and vicious and horrible. But then once I realised, as Ciara has said, it's coming from fear, it's coming from anxiety, it can be coming from malignancy, if that's the right word. There are malign influences among them, remember, and that's a bit disturbing. But then politicians have to face that the whole time as well. So it didn't really bother me, because I'm too old. If I was younger, I might be bothered by it, you know. And my reputation is, I think you'd agree, Paul, okay, you know, so it's not going to affect my career in any way, or my capacity to write grants to the Wellcome Trust. They wouldn't be looking at that, you know. So I was never in any kind of fear over it affecting me, other than just people being nasty to you. It's not very nice when someone uses abusive terms that you don't know. You then realise, I came across a great phrase early on, if you play rugby, expect to get hit. So if you're going to be out there, you're going to expect to get hit. And then once you realise that, I began to think it was a bit like being in primary school where someone shouts at you across the playground. That kind of level, you know. But it's just something you just got to get used to, and you block it all then anyway. I read a great piece by Fintan O'Toole actually about social media attacking each other, teenagers mainly. Put blinkers on was the phrase he used. And he had a great phrase, and Stephen Fry said this as well. He says, you can have a pristine swimming pool. You see one little piece of shit and you obsess about that. You forget about the rest of it, you know. It's that kind of thing. One negative comment and 1,000 positives,
Yes.
you're drawn to the negative. And that's evolution, by the way. We're evolved to protect ourselves. So if you have one little piece of danger, you'll be alert to it, you'll be drawn to it. And you got to eventually realise that's a human response, and you get used to it and just carry on. The only thing I worried about was getting it wrong. So, and sometimes I did get it wrong. And then they're on you like a ton of bricks, of course. If they find you made a mistake. Because remember, there's a malign influence to discredit experts. And you're vulnerable then if you make a mistake, because they'll use that against you. And I would just then try and correct the mistake the next time I'm on, and just ignore it. That's all you can do, really. And our job, Paul, anyway, was to get the facts out as accurately as we could. That's the mission here. So if you got something wrong, you're failing in that mission. That was the only bit that would make me feel bad if I realised I got something slightly wrong, and then you mightn't have a chance to correct it anyway.
There was also that scenario though that you wouldn't necessarily get things wrong, but things would change.
That's the separate
so then
thing,
when circumstances or facts change, science changes, because we're not.
Yeah.
That's how it's supposed to work. So then you change, and then they go, haha, that's not what you said last week. And it's like, you got it wrong. No, I didn't get it wrong. Everything changed. Like, and that was really hard to communicate. I think that I'm saying something different now because a few other things have happened that we now know about, and that was really hard to convey to people who kind of thought, you know, that we were being paid by somebody, like there was some overarching conspiracy going on that we were all shills to. You know, I think we probably have both been accused of being shills quite a lot.
Absolutely. Well, no, I would talk to people in the US and the UK, a lot of friends of mine who are in the media, and they were getting the exact same thing thrown at them. So they would accuse me of making money out of it, right? Being paid by drug companies. That's the big one that they always say, you know. as a second thing. Thirdly, you know, just trying to be famous and in the media, and everybody we all got it, you know. And then the most malignant was death threats. I must have had about 15 real death threats against me, you know. And that's disturbing. Now, when I saw them first, the guards got involved in Trinity, because they came in looking for me one day. 30 people turned up with pitchforks. I imagine them having pitchforks anyway, looking for Luke O'Neill, right? And they went to the neuroscience building because they can't read. Don't film that. Anyway, the provost...
It's going out live.
The provost got upset then. Well, the provost gets upset and he rings me, oh, Luke, this is in the workplace. I'm going to give you security, right? I had 3 months of a guy as my bodyguard. Isn't that great? And he would come with me up to they would get me outside News Talk.
I look where you had security in News Talk, and I was
didn't,
working
yeah,
there. They were trying to break in to get at me, and I had no security.
I know. We could have shared my security. But the best was that they knew I was at News Talk because it was in the schedule. They'd wait outside News Talk for me, you see. But the best was my security guy was a guy called Ciara from Tala, and he was ex-Irish Army. Great guy. Looked cool, he had shades. Like a man in black type thing. I brought him into my lab actually to meet some of the people in my lab. And he said to me one morning, he says, oh Luke, my wife's delighted now I'm your security guard. And I said, thanks very much. He says, no, she's calling me Kevin Costner. So that was the good one there. But it was certainly surreal for me, a scientist, to have a bodyguard. I mean, the times we live in is outrageous, isn't it? It just shows.
Price of fame.
Well, that's one word for it.
So people are getting their information from many different places now. You know, if you look, we get it from scientific literature and from broadcast media, print media, but social media now is, you know, fantastically powerful in both positive and negative. So in terms of communicating information, sometimes fairly complex information, and distilling that down. So there's a lot of good in there as well, but there's also a lot of good information, but also misinformation and disinformation. So what role do you think here, you know, social media has played in terms of, you know, for example, if you look at vaccines and the anti-vax sentiment and things like that, what role do you think social media has played a role in terms of amplifying that voice?
I mean, social media amplifies all kinds of things. It's you know, it's one of those kind of things that can be used for good or bad. So it amplifies the good and the bad, and I would agree with people who think that we need a greater degree of things like media literacy maybe taught in schools, because, you know, I'm still amazed the crap people occasionally send me, like links to things on rubbish sites, rubbish sort of links. Look at this, somebody said this has happened. And we probably remember at the beginning there was all sorts of WhatsApp messages going around saying if you just sip water 20 times a minute, you won't catch like normal people were sending these things to me going, have you seen this? And you're going, oh my God. So like there was all sorts of stuff amplified, and some of it was absolute rubbish, but some of it, you know, there was good stuff out there too. I think on balance we must have done more good than harm here in Ireland if you look at our vaccine uptake. I think that's I think if you look at outcomes, that's a good way of measuring it, because our vaccine uptake, people talk about how great a vaccine programme we rolled out, and we have. There was great speed to it. We can get on to what the boosters have been a bit slow now, to be honest. But anyway, to the rollout, we did really, really well. But what we forget is there was two sides to that. There was the delivery, but it was also in other countries, it's not just that their deliveries weren't good. The population didn't take the vaccine in the same numbers. Our population had much lower levels of vaccine scepticism here. And I think that is partly because we maybe did have good communicators like the Luke O'Neills, but also we had fought a few other battles before that. I'd been in the wars with anti-vaxxers long before COVID with things like the HPV vaccine, and had written about it, and you know, and so I think we here had on balance, now that's not to say there isn't a pocket of hardcore people who still think that, you know, we're being paid by Pfizer and that we're off drinking sheep's blood or something. I don't know what they think, but that, you know, there's something behind it all. But I do think that we managed to hold the line against some of the more crackpotty stuff that was out there. So, I think that the way of measuring that is the uptake of the vaccine, which obviously has been good. So I think we here still have a relatively cohesive society, which I think is an important thing, possibly because we're smaller. Now that creates an insularity, which I think maybe we have been too inward looking and we probably get onto the science, but I don't think we have embraced as quickly. So, you know, some of the scientific developments that have happened, I think that's why we've been an outlier on things like antigen tests. But I think that cohesive kind of society that we live in, and maybe a greater trust and a lower scepticism, we have been slightly protected from some of the worst when you compare to somewhere like America, effects of social media, which can also be used for bad. So when you look at America and you see people, ripping off their masks, I won't be anyone's food, like it's become politicized and all that stuff too. Luckily, we didn't have any real opposition that politicised the public health measures. So we didn't have people saying, you will never take my freedom, and setting fire to masks and all. We probably had a couple of people doing that, but most people were like, bless. Do you know what I mean? They weren't really sort of falling for it. So social media, I've had my ups and downs with it. I'm not a massive fan of some of the platforms like Twitter, but I think we're doing okay. I'm trying to be, you get me on a positive night, I'm trying to be positive with a lot of things. I think we're doing okay. There's a lot of rubbish out there, but I think the sensible messages are hitting home in a greater proportion than the lunacy, really.
And probably the tech companies are probably trying to control in terms of and trying to determine what's information and disinformation. But you end up with, like, I think there was one farcical case where the Cochrane Library, which is one of the most prestigious in terms of systematic reviews in medical research, and that was actually banned by Instagram, So you end up with those situations as well. So it's really important in terms of how that is communicated and what is...
There's some, I think it's fair to say, you were talking about malign influences. There's some definite bad actors out there, some of whom would be malign, but some of whom are just looking for likes. And there are people, and we had a situation here where there was a couple of people who had relatively high profile in Ireland, maybe not super high profile, but were becoming a little bit like conspiracy theorist, kind of anti-vaxxy kind of thing. And my sense from reading the drivel that was being put out there by them was that they were preaching to a certain choir, that they were getting a little bit of attention from a certain cohort, and any attention was better than no attention. And there was an element of that too, that a lot of people just want someone to like their post or whatever it is. And so social media is like a weird playground where adults often behave like children, to be honest.
I think the Irish are very to be given praise, Paul. Now we're Irish ourselves. But the fact of the matter is this, most people are decent in Ireland and they're out for the common good. Now, there are people who aren't, but the majority are. And they all realise that vaccines is for the common good here, and let's try to work towards that together. Secondly, they'll spot the gobshite, Irish people often, if I can use that word, and they begin to realise that's rubbish, really, I think, I prefer this person's opinion here. And not to blow our own trumpets, but the likes of yourself. I mean, you'd be a trusted voice because you've got a good reputation as a scientist. You come across as someone who's sensible, and that counts for a lot with people who aren't scientists. They'll trust us because they feel that we aren't going to try to sell them a pub. Now, I think it's partly because Ireland is a small country. We're also blessed. I know we're all praising ourselves here, but there's a great media in Ireland. Most of the media is good. And the Irish are so plugged into it. Everybody's on the radio, listening to the radio all the time, right? So the amount of information exchange, like everybody knew by 3 o'clock today the nightclubs are closing at midnight, because it's in the media and we're all listening the whole time. And it's a strange community spirit there in a way. And then we all know the politicians as well, so they're part of this narrative too, you see. So and that's one reason why I think the vaccine uptake was so high as well.
So I want to move on now and discuss how science has informed policy, and that phrase that is used all the time, we follow the science. You hear a lot from government and politicians, we're following the science. So if you look, I read your book, Luke, so look, if you didn't know, he's about another book.
And there's one for everybody in the audience. I knew the bot.
So it's stay calm, trust the science.
That's it.
But I noticed early on, Luke, you get up one morning and you see suddenly there's this new body that's been formed called NEFIT. And one of the things, you look down the membership, there's now about 40 people on NEFIT, and you said there's no scientist. And that's still the case.
Yeah.
So when you said, I don't know what your response was,
Bah. Yeah, I didn't curse on that.
No, you didn't.
That was later.
But tell me about that, Luke, in terms of, do you think that's a major deficiency in terms of science informing? It's an advisory body that advises, and the government obviously then has to make the decisions based on that. Do you think that's a major deficiency?
Now, Kingston Mills told me to write "bah" there. I'm only kidding him. Kingston's a big advocate for scientists in all these committees. But it is a public health body, though, isn't it? I think what was more disturbing was the number of people who weren't anyway medical or scientific on that. My reading of it was at least half the number of administrators. Were they here? It's really strange.
Yeah.
So that was one odd thing I thought, because they're going to have... Now, I'm not knocking them either, by the way, but you want balance, don't you? You want a range of opinions on those sorts of committees. And given that NEFIT turns into a body to look at science, because it was looking at all the data and there's modelling and there's antigen testing, they should have had more scientists on it, it makes sense. And secondly, given that we have outstanding scientists who could serve on those committees, I know they had some subcommittees, didn't you? You were on a couple of those subcommittees, I think, weren't you? For a while. Was that reporting into NEFA directly, or was that...
No, early on I was asked with a number of people to submit a report on testing.
Yeah.
So that was very, very early on. And we put together, we submitted a report, and we never got any response from that in terms of... And the idea there at that stage was to... Like, there was a really big shortage of reagents at that stage. I'm not sure if you remember that.
Yeah.
So we were looking at the possibilities of maybe rolling out localised testing and involving universities. But again, I'm not sure... We never heard anything back from that. But that reported into the expert advisory group that then fed into NEFIT.
Right,
But
yeah.
it always struck me in contrast that, for example, you look over in the UK, and the UK has got some things really bad and some things really right, but you saw somebody like the chief medical officer side by side with the chief scientific officer. And here really, the chief scientific, and this is not a criticism of the individual in terms of chief scientific officer, but so Mark Ferguson authored the report on the antigen testing. And that's sort of me the main, presence, but we haven't really seen that scientific presence. But if you look in the media, for example, scientists are very, very prominent. But in terms of the bodies that are used to, feed into NEFIT, there seems to be...
Well, I think I'd like to ask them the question why there weren't more scientists on there. I don't know what the reason is, you see. But was it intentional?
I think one of the reasons there's more scientists out than doctors to some extent in the media is doctors aren't breaking ranks. I would know a lot of doctors personally, and there's things that they would say to me off air that they would never say to me on air. And so I know their views on quite a lot of what goes on, and they aren't necessarily happy or they're not necessarily thinking we're getting things right, but it's a very hierarchical, it's a very collegial, and it's a very old school profession, medicine, and I say that as a doctor. And I think it was, as someone in the media, it was easier for us to get scientists to come on and talk to us. So we started talking to the scientists because we couldn't get the doctors. And if they did come on, they wouldn't say anything. They wouldn't criticise anything. They would say, and they'd hum and they'd haw and they'd sit on a fence. And we were desperate for some information. And the only people willing to come out with facts and actual sort of, opinion or analysis were the science community. And so the science community became represented in the media because of that. And I think medicine should have done more.
Yeah. And Ciara, on that front, scientists often get criticised in terms of, and being told to stay in your lane. So, and sort of,
I'm sure you've been told to stay in your lane. I've been told to stay in my lane. That's an element of control. I don't think you need to stay in your lane if you have a background that you have something to say and you're a good communicator. Staying in your lane doesn't really serve anybody necessarily. You'll soon be weeded out of the wrong lane if you're talking rubbish, and that's the way. But there have been issues about and I said it today on air, so I don't mind saying it here now. I think the way we have cabinet reshuffles. I think we could use a NEFIT reshuffle. I think we could bring different aspects of expertise in there, and it would be a good thing.
Well, they're about to be shut down, weren't they? A few weeks ago.
So we heard, but that doesn't appear to be the case now.
So I want to go on and look at sort of specific areas where science may have informed some of them, maybe not. So early on, back last April of 2020, the healthcare system was coming under serious pressure, and we moved to lockdown. So if you look at pharmaceutical interventions like vaccines, for example, like the antivirals that you spoke about, Luke, it goes through a process, a stringent process in terms of evaluating benefits, but also risks. And then you make a call in terms of, if you look at the non-pharmaceutical interventions, such as lockdown, so prior to the pandemic, the WHO had recommended, back in 2019, that in the case of a pandemic, we shouldn't have lockdowns, we shouldn't have global lockdowns, we shouldn't have quarantine. And yet suddenly the pandemic arrives, and then globally we go into these lockdowns where, immediately at that time there was no evidence in terms of do they work, are there risks associated with them. When you look back, do you think, and this again just partly in terms of what my view is, but I'd like to get your comment on it. So do you think there should have been some committee, some group in terms of looking at whatever was recommended by NEFIT in terms of lockdowns, not only to look at the benefits, but also the potential risks, whether they be economic, whether they be non-COVID health. Do you think there would have been value for something like that? So to look at the risks of some of the decisions we were making around the interventions, or did we just have no choice?
I think it's extremely difficult because you won't get evidence, you know, and if you do, we mix anyway with these very complicated things. It's human behaviour you're talking about, which is an impossible thing to predict. So, and I remember reading in The Economist in February of 2020, we probably have 50% of the information we need to make decisions here, which is very difficult then because you're missing an awful lot of information. And of course, lockdowns, as we know, they became known as lockdowns. That was a new word to us all, wasn't it, as well? So I think it's very difficult because, of course, they're harmful. And I tried to get evidence myself from previous lockdowns in Africa during Ebola outbreaks, for instance. And it's very scrappy, the data, you know. So it's very hard to be definitive on these things. Secondly, there's a sheep mentality here, remember? As soon as Germany does it, we all do it. Because a politician will not take a risk on not doing it. Like Sweden were lambasted, remember? And they're still being lambasted because they had a light touch approach to it, you see. So it's very hard for politicians then to know what to do in that situation, I think. You know?
I guess there are situations where public health, they have to make decisions even before the science is known. Like,
I would subscribe to the idea that NPHET should also have had somebody involved who maybe at least came from that perspective at looking at the risks.
Yeah.
You're quite right. How, you know, and I don't think I think it is very trite to say that that you could reduce this to health versus wealth, because I think the knock-ons from things like lockdown are much more far-reaching than economics. But health economics are a thing. You know, in every other area of medicine, when you, as an example, cystic fibrosis drugs, really expensive, relatively effective, not massively effective, but they cost a huge amount of money. They've always been rationed, and in countries that have free kind of access to healthcare like the NHS, everything is rationed and everything has to justify the expense that the health service will spend on something versus the lives saved or the lives improved. In COVID, and I think this is kind of what you're getting at, health economics went completely out the window. If it cost us 30 billion to lock down, if it cost us 400 billion to lock down, we did it. And we didn't work out whether or not that was going to save 50 lives, 1,000 lives, 10,000 lives. So we didn't have that information. And maybe we couldn't have, as you said, the evidence was scanty, but our modelling didn't even look at that. And that, you know, other groups started to look at that, not the government. And I think when you kind of go, oh, the health versus wealth, you know, it doesn't matter how much it costs to save a life. Well, it kind of does, because if you look at this country, for example, I would have practiced for 20 years as a doctor from sort of the late 90s to almost 2020. So that 20-year period, I mean, during that we had a boom and a bust. And in the bust, we couldn't get patients seen. So we were broke as a country, and it meant that the waiting list for cancer and for surgeries and for scoliosis and for people needing anything by way of medicine or medical interventions was basically long-fingered because we didn't have the cash. And so there is a cost to the country being broke in terms of the health of the country. And we know that things like breast screening stopped. We know that things like cervical screening stopped. We know all that stuff stopped. So we know, and I remember I said this, and I was absolutely trounced for this online before I left Twitter. I said, when we lock down, you have to recognise that you're trading one set of lives for another. Yes, you are protecting people from COVID, but over the next decade, you're going to lose 100, 1,000, 10,000 lives to things like cancer that weren't picked up in the year 2020 and 2021, and then won't be picked up till maybe 23 or 24, and therefore you'll lose more lives. So there is all these different things at play, and that is why I don't think that lockdowns should have been quite as, how to put it, you know, taken on board as well, because I felt that we, you know, you mentioned having blinkers. I felt we did have blinkers. It was like, stop the COVID. And maybe there was an argument for that, but I never heard it made very cogently. Blinkered view of COVID and let everything else, the mental health, the alcoholism that we've seen, the domestic violence that we've seen, all the other knock-on effects, the non-COVID related healthcare that got shelved. There was a massive cost to doing this. And I'm not saying we didn't get it right. What I'm saying is we didn't look at whether we were getting it right or not as we went along. And I would have had an issue about that. Largely because, not in the beginning, I actually wanted us to lock down, very much so, and would have locked down even, as I say, before NPHET or the government did. I remember looking at Cheltenham and going, we are insane not quarantining these people coming back from what looks like a super spreader event, or even the kids coming back from North Italy from the skiing trips and all that. I was saying, we are insane. We can see this. And we have failed to move quickly on a number of occasions, and we failed.
So do you think here that some lives may have been saved, but at the expense maybe of other lives?
Oh, I think there's a
dying? That's
definite truth that
not
some...
calculus.
Well, if
I
you
know
look
it's
at
very
breast check
cold,
was
but-
suspended, I think it was for 10 months.
Yeah.
And breast check, I think, picks up, I could be subtly wrong on this, but I think it picks up about 100 cancers a week. 10 months, so that's 40 months, so that's 4,000 cancers missed. Not all of the people who will be missed will thankfully die. They'll have been picked up a little bit later and they'll be saved. But you can extrapolate a certain number of those lives will be lost. And health economics goes even further, and I don't know if we even want to say this, because this is actually, it doesn't just look at lives lost, it looks at months of lives lost. So if you're losing the life of a 6-year-old who has 90 years ahead of them, or if you're losing the life of a 96-year-old who has a year ahead of them, those two things are not considered the same. And that is not to be crass or crude, but when you're trying to save the lives of a population, you start playing with statistics to try and get the best outcome so that the most people live for as long as possible healthy lives. And we didn't look at things like that. And maybe there was an excuse for that in the beginning because we were
Why
moving...
do you think that was the case, Ciara? Was it
Fear, more fear and panic stations and just do something, just do anything.
Yeah.
And I think, you know, and also someone
do
like
you
Tony
think we're
Holohan,
still-
who I would have a lot of respect for, is a very strong figure. He's a very strong man, and people were crying out for leadership. So he was there and he's going, we're going to do this, this, this and this. And do you know what? I think a lot of people were glad to hear anyone say, I have a plan. Do you know what I mean?
Whatever
I
the
think
plan is.
whatever the plan is, it could be the wrong plan, but someone has a plan, let's do that plan. So there was an element of that. But now we need to become more reflective, I think.
I mean, I'd never be an epidemiologist, Paul, because it's a very difficult science with no clear conclusions. I like being a lab, an experiment.
Blow it up,
I'd
see what
never
happens.
be a psychologist or a sociologist because it's very difficult. And they can't be happy themselves because they can never get to a bottom line they can really believe in. There's always caveats
Luke
and
O'Neill
uncertainties.
says sociologists can never be happy.
They can never be happy.
That's what you're all going to take home
paradoxically, the psychologists are unhappy, and I'm sure they're very happy. But no, can I ask, like, you couldn't do the experiment again and not have a lockdown and see how many would die from the virus to compare the two, you see. So that's too difficult to achieve, obviously, you see.
And not
so,
very ethical.
and not very ethical. But if you're a scientist, you're trying to limit the variables, test the hypothesis. There was no hypothesis to test here. Just lock the place down and hope for the best. There has to be knock-on consequences. Of course there has.
Do you think, Luke, on that front, have scientists and sort of science as a whole, have we missed the opportunity to do some of those studies? So, for example, if you look at mask mandates, and there's a lot of observational data, epidemiological data suggesting the masks do work. But if you look at randomised controlled trials, there's a couple out there, one from Denmark, one from Bangladesh, you know, the efficacy and the numbers coming out of them aren't overly impressive.
No, they're not.
So, but we've done very few of those studies, and even in terms of interventions, I'd probably argue that we don't actually know what interventions work or which ones are the most
That's the
effective.
trouble. And it's very hard to do the definitive experiment, remember, because again, there's too many variables. Like there was early trials quoted on mask wearing. We said masks actually enhance the spread of the virus because people were fidgeting with them all the time, or they weren't wearing them properly. It's human behaviour is very hard to study at the best of times. In a pandemic, it's 10 times worse. So that was always frustrating to me. I would say to people in the media, I said, don't ask me about masks again, or don't ask me should we open the nightclubs. Because I don't know the answer to that question. Ask me about the antivirals. Now, because you had to answer those questions because it was unfair on the interview.
But if you look now, bring us right up to today, we're looking this evening at likely possibility of vaccine certs being extended to other events or other places. Whereas if you look, for example, over the UK, which is probably a good comparison, so back in the summer England opened up. Places like Wales and Scotland, they still have vaccine certs, and if you look at the numbers now in Wales and Scotland are actually higher than in England. So some of what's, for example, being proposed this evening, do you think that's just tinkering around the edges really in terms of whether it's, and it will come out in terms of we're following the science here, whereas actually if you look,
there isn't much science behind it.
Yeah, and sometimes it's just the science isn't there.
Yeah.
We shouldn't then be saying we're following the science.
Well, I would say, if I was the Taoiseach, I would say 3 things need to be done now. Get the booster into as many arms as quickly as possible. That's the emergency. That's 90% of the task ahead of us now, right? Yeah. Secondly, I'm not against vaccine certs to protect the unvaccinated, strangely. Because if someone's unvaccinated and they go into a venue full of vaccinated people, there's a risk of them getting infected, paradoxically. You know, that might be a reason to extend them, to protect the unvaccinated. No other reason. Because we know when you're vaccinated, you can still be infectious.
It also works as an inducement to get.
And that's the other reason, Ciara. The third one is get the antigen testing out as widely as possible. And the trouble with that is there are places that use that widely and there's still very high case numbers. There could be other reasons for that isn't to do with antigen testing. It's very hard to say the reason for that is, you know, lack of antigen testing. But we know in the UK, I was on the phone today actually to a teacher who's a friend of, happens to be a wife of a friend of mine. They have antigen testing every Sunday night. All the kids have to do an antigen test, and they call it like the homework, and they all hate it because it goes up the nose. And they're catching 20% of cases in schools in the UK. If they hadn't have had antigen testing in the UK, it'd be worse there. You know, so it's that those are the three things to do. If we do those three things now in the coming 6 to 8 weeks, that'll have a big effect. Not shutting down nightclubs or
the 12, that's
all these various other things.
And no disrespect, but it's tinkering and it's window dressing. I would add into that potentially we maybe should be looking at something like a mask mandate and maybe an N95
mask. N95s,
because they're different to the ones that any of you guys are wearing, which is fair enough. They just sort of seal around here more, and they are. And if you've worn them, they're slightly uncomfortable to wear because you really do get a lot of blowback of your own breath. It doesn't mean you're losing oxygen. It doesn't mean any of the crap you've heard. It just means they're slightly more uncomfortable to wear because they're slightly more effective. With regards to the antigen testing...
And they're trying to show that they work.
Yes. So I think mandate them N95s, antigen testing. I think the reason we didn't use antigen testing was a couple of reasons. One is we were in lockdown, so antigen testing, sure, it doesn't really matter because you're all locked down at home. Antigen testing are really, really useful if you are open up. If the society is open, it allows you to do things. And in fact, I was very keen on us reopening on the 22nd, but I did say when they opened, I went, this isn't going to go well, lads, if we don't do antigen testing, because we're all just going to mix in nightclubs and everyone's going to be with each other and whatever. But we don't know who's infectious and who isn't, so we've kind of missed a trick, and I still think that. But I think my own personal view on this is our public health position has been very paternalistic, to be honest, from the beginning. And that's why we didn't like masks. And that's why we didn't like antigen testing.
Can't
and that's
trust
why,
the people.
That's why we preferred the lockdowns, because then we knew where you all were, and that was what kind of suited us. Whereas other societies that are a little bit different and operate slightly differently, we have a history here of treating the populace as children, and then maybe sometimes the populace behaving a little bit like children too. But in other countries that don't have that, they were allowed out and they had the antigen testing, and it was a different interaction. And I think we have had historically quite a paternalistic society, but also quite a paternalistic medical system in this country. And I say that as somebody who worked and trained within it. We do, and we did, and we still do a bit. And this was more of that. We should have had antigen testing. And I think the last thing, and this is the worst bit, apart from the paternalism and all the other things, is I think they didn't want to do a U-turn and lose face. And that is the most unforgivable bit of it all. Because if you are a scientist, and if you are a doctor, and you are following the science, when facts change and evidence appears, you move with it, or you do a disservice to the people you're supposed to be serving.
So, Ciara, on that, you'd have heard, and you've interviewed a lot of politicians, and they would come out, and many of them would say, including the Taoiseach, and sort of saying, I'm very much in favour of antigen testing.
That was
and yet,
inexplicable how the Taoiseach was in favour and we didn't have it.
And yet that didn't translate into any sort of decision
I
making.
interviewed the Minister for Health, I think it was about a week ago, and before all these latest developments happened, and I asked him about antigen testing. We're very fond, we love antigen testing. Why don't we have it then? NEFIT. Well, then what? Then NEFIT aren't giving you the right information, because everyone. I said, and I probably name checked both of you, and I said, because every expert I speak to, and myself included, and I'm not an expert, but I everything I read tells me we're getting it wrong. So why aren't we doing it? And there was no expert. And I asked him about working from home, and I asked him about all the things that now have come to pass, and it was all NIAC and NEFIT, and you know, we shouldn't be hiding behind our experts. If our experts aren't getting it right, we should be rebooting that in some way, or perhaps looking for our expertise a little bit elsewhere, maybe. But it is inexplicable to me that we would have the Taoiseach of the country coming out and saying, I'm pro-antigen testing, and we don't have antigen testing. And even now the antigen testing we're talking about rolling out is not what we actually need.
In science, Ciara, we often differ with each other.
That's
in terms
fine.
of,
Yeah.
you can look at
You
that
want that.
and differ,
You do want that, because then you find the actual equilibrium.
It's a healthy thing. Do you think there's a sense that, you know, a body like NEFIT are not questioned, you know, in terms of, for example, around antigen testing, I think there were 2 criticisms from NEFIT about antigen testing. So one is in terms of not good at picking up asymptomatics.
Yeah, but it was,
And
they
the
were
other one would promote-
misinterpreting or
Yeah.
misunderstanding what
And
it was
then the
useful
other,
for.
and the other would promote maybe more reckless behaviour. But the bottom line was what the antigen tests are really good at, does it pick up somebody's infectious and non-infectious, and at that it's about 80-90%. Now if you go back 18 months ago, back in March, and you were told you had a test that could detect 80-90% of people who were infectious, and at that stage you were told you were not going to employ that test.
Yeah.
Like, it's crazy. So
We have ignored it at our peril because not using it makes it more likely we'll end up back in a lockdown with restrictions. That's what it actually is. While we are open, we should be using them widely, and not to do that is.
So do
is
you think
stupid.
politically
Is
there
that
should be
fair
some
to say?
accountability here? In
Well, I was
terms
kind of
of
ranting about it this
structure
morning,
or-
Paul, saying who is going to be responsible for this, because they're getting something wrong, and does anyone put up their hand and go, yeah, we got it wrong? And it seems to me we all hide behind the, it's all emerging and evolving, but there's evidence on antigen changing hasn't changed in about a year, so it's not emerging, it's already a given.
Well, there's a worry now, Paul, isn't there, in the next 4 to 6 weeks, because this could really go badly wrong for the country.
Yeah.
Now's the time to show leadership, as I said. But we have a chance, and the big thing for me overall, we're never helpless in the face of this virus, remember. That was always the case, because we can deploy these things as best we can.
Yeah. Do you think, Luke, we've moved with the science, even in terms of our messaging? So very early on, and even still, it's sort of, there's a big focus on hand washing, and the reality is, no, this is an airborne virus now. And I know I'm sort of involved in some local, primary school management, and back in September when we got the guidelines, the schools are opening up again, and there was still that sense of, good hygiene, an additional budget for deep cleaning, which doesn't make any sense at all from an airborne virus point of view. So instead of putting that into things like air filtration systems, HEPA filtered systems, there was still that focus, almost as if we didn't move with the science.
Yeah.
And again, there seemed to be a deficiency. Did you sense that?
Oh, I did,
Or
yeah.
am I
Well,
being
there was the lip service thing, wasn't there? Good
Yeah.
ventilation in schools was
Yeah.
mentioned a lot. It
Nothing
doesn't
was
seem to
done.
have happened as
Nothing
much
was
as we
done.
want, right? So that's a funny
Yeah.
one. Is that because they can't afford the ventilators,
Like it was
or the
extended-
ventilation system rather, or is it because it's lazy, or it's sort of, it's a strange one, yeah, because it's obvious, it was obvious to all of us. And there was one analogy which someone in the media said, some scientist, can't remember who it was, if this was a waterborne disease, we clean the water, you know.
Yeah.
It's an airborne disease, clean the air. It was as simple as that, but yet that didn't seem to register, did it? It's a mystery to me why these things didn't register, especially when the science was so clear on it.
You alluded at one stage, Ciara, to the role that the modellers and modelling has played, and really it is given a lot of weight in terms of framing our decision making. And I think, do you think that modelling is perceived as like weather forecasting in terms of trying to forecast what's going to happen, as opposed to what it actually does is it just presents us with scenarios, but inevitably the decision makers in the government inevitably are going to go to the most pessimistic.
The 700,000
and
cases
yeah.
and all that business.
And so it definitely has a role, but do you think its role has been overstated or over relied on?
It does have a role, but I think
And I should
It
say,
has-
in terms of the modelling here, like some of the people here from this university have done a fantastic job in terms of the actual mathematics of it, and Philip Nolan, former president, has actually headed that group, and
Yes.
fantastic in terms of communicating this. And
it does have a role, but it obviously has, because as Luke says, because of all the different variables, it has feet of clay as well, because we're not exactly sure what's going to happen. So therefore the modelling is a bit vague, and that's why we've been given these widely disparate best and worst case scenarios.
Yeah.
So and there's a huge
Well,
range in between those
if I said
two.
to one of my students, Paul, go and do an experiment and bring back the answer, and he says, well, it could be 10 or 10,000, that's the answer. What do you mean it's 10,000?
Yeah.
But I'm not blaming the modellers
No,
now, it's just the
no.
nature of it. But if you're the government, how do you react to that? You can easily say, will we go in the middle here? The worst case scenario, they lean towards that, just in case the whole country is destroyed if we don't act, and it is that number, so it's a difficult one for
I
them.
think it is essential, because otherwise you're just guessing. And
Oh,
to,
yeah.
to a degree, it's completely dependent on the assumptions that you make, that you feed into the model. So I think you have to look at the assumptions that have been made, and sometimes that probably question.
And we have been
some of
quite
the assumptions.
pessimistic, and I think we talked about the media and how the media interprets this. First of all, the media is out of its depth. I already know that the kind of conversation we're having around this table tonight is not one I'd ever have on air, because I'd get in trouble afterwards, not because there's a conspiracy, but because people say, yeah, no one knew what you were talking about.
Yeah,
What
exactly.
are you talking about? What you go down that rabbit hole with so-and-so about? No one wants to hear that crap. So first of all, not everyone can have these conversations or understand them, and that's what the media kind of lowbrows things a little bit, because they know that the listenership doesn't, it's not because the listenership is unintelligent, but it's just not everyone has a scientific background, so that changes. So they're out of their depth, that's one aspect of it, but also then politicians are terrified of not getting elected. So if there's a possibility there's going to be 700,000 cases, however unlikely, Jesus, they run scared from that in a really major way. And Dan O'Brien, who's a columnist now in the Sunday Business Post, wrote a lot of columns over the last year. Actually used to be in the Sunday Independent, he's moved, but in the Sunday Independent, going, why is Ireland and why is Irish media so anxious in how it talks about COVID? We have the daily case numbers. We had them all along. Other countries didn't do that, and we had all the, pictures of people who died up on kind of loops and stuff. Like, we had all kinds of very sort of pessimistic, fear-filled, anxious. There was a kind of an ideology behind how we looked at all of this that was very anxiety-driven, I do think. And I wondered, and I was thinking of all the sort of, even from a psychologist look, I was thinking, was it sort of some kind of intergenerational trauma from the famine? Is that what it was? But then I was thinking, no, because continental Europe had world wars on their soil. And then I wondered, was it an island thing? Was it an insularity, that we have a siege mentality, that we can just, all the zero COVID people, which never made any sense, pull up the drawbridge, we can just lock down, like the New Zealands and the Australias. And I wondered, was it that? Is it the island nation that we kind of feel, if we have to, we can just cut ourselves off from everybody and we'll be okay? And I don't know, we did interface with COVID in a way that perhaps, and that's not to take from the people who've lost lives or have been sick or suffered, because I know that they exist, and that is obviously personally a terrible thing in anybody's life or anybody's family. But I wonder, did we interact a little differently to elsewhere, and was there an element of fear, and what was the cause of that? I do wonder about that, because I think we did interact a little differently.
I think as well here, the political decision making must be really, really tough. They're making decisions here that are sort of life and death, and livelihoods are at stake and things like that. And probably they're looking for some protection as well in terms of saying we're following the science, we're following the modelling, and there's
a cultural difference too, and maybe it is to do with the wars. In the UK they take great I'm not saying one place is better than the other, I'm just saying culturally everybody is different in different countries, and in the UK they take great pride in their blitz mentality. Do you know what I mean? We'll defy the virus, and the British bulldog, that's a thing. We don't really have that. We don't really we never sort of said, we'll face this thing down. We kind of muttered about living with COVID, and then as soon as the cases climbed, we immediately locked down. So we have had a different attitude to it. And I think culturally, if you look around the world, as much as science, culture in different countries has fed into why
but I've
countries
got a question
have behaved.
here. Underinvestment in the health service here is a factor as well, remember? I mean, at the moment it's all about number of ICU beds. And I saw some table on Twitter tonight, we're well down the list, even before COVID began. So that must make the HSE anxious.
We have 8 beds, I think it is, per 100,000 here, and in somewhere like Germany, I think it's 29 beds per 100,000. I may be subtly wrong, but I'm not that far wrong on those figures. Yes, and that is an issue, but I think at some point the people, you guys, have to push back and say it is not the job of the people to protect the health service, it's the job of the health service to protect the people. And sometimes the wrong conversations are had. I think people don't know what they should be annoyed about sometimes, but that's one of the things they should be annoyed about.
We want to move on to vaccines. So vaccines sometimes are sold as sort of the silver bullet, and now a lot of people are thinking.
Oh, you're not a man for the cliches normally.
No,
silver bullet.
But there's a lot of concern, I guess, now at the moment in terms of they're not actually working, they're underachieving. But I would take a different view. I think they're been incredibly effective. Like we're dealing with levels of transmission now that are so high. And yet the hospitals, hospitalizations, ICU numbers, but in terms of relative to the level of transmission, they're still doing a fantastic job in terms of protecting us. So where do you sit now in terms of when you look at booster programs and things like that? Are you in favour of sort of a mass booster program? Should it be more targeted? Where do you sit?
No, I think it touches on what Ciara said at the very start, to be honest. The public want clear answers and clear solutions. They don't want you and me to be debating adjuvant C during a vaccine, for instance. And we told them all the vaccines are great, okay? That goes into their minds. In an average person's mind, and these are just everybody, who isn't a scientist, they're going to go, this will get us out of this, and I'm going to get vaccinated. Next thing we arrive, about a month ago, it all begins to go off the rails, and yet we're 90% vaccinated. They're immediately going, you told me, and they are letting me down, So there was a deficit in expectation management there. Because I was saying, you will get infected if you have a vaccine. It'll grow in your nose, it won't go to your lungs, you won't die, but you might have sniffles. We've been saying that all along, you know. So it's no surprise people who get vaccinated are getting infected, you see. Now, how we could have done it better, I don't know. We could have said, vaccines are great, but there may be some issues. You can't say that either, because that doesn't work.
Do you think scientists failed in terms of communication?
I think it's very...
Because if you look at other vaccines, like vaccines against measles, that induces sterilizing immunity, stops you getting infected, lifelong protection. But that's very, very unique. Like if you look at most other vaccines, the will, and definitely a booster program, will stop and reduce cases and stop you getting infected for 5-6 months.
Yeah, well, I began saying about a month ago.
But that message wasn't clear, and now the impression out there is vaccines are no longer working, because they're still working really,
But it's very hard to convey the message. This is the issue. We could have done better, or tried harder, I suppose, is the first answer I would say. Like I began saying a month ago, if we didn't have the vaccines, we would be in a full lockdown now. Because there's a chance of that, because in other words, the vaccines are protecting people.
Absolutely, will be in a full lockdown.
So that's evidence that they're working. You don't want to be in a lockdown, the schools closed, everything again, and the reason you're not is because of the vaccines. Now we know there's still cases, we know the hospital's under pressure, and now we know what to do. It's a brand new virus, they're brand new vaccines. The Israelis have shown us the booster is what we need. And I know you don't want to hear that because you believed it was all over with your 2 shots, but the fact is we need the boosters. And then we've scientific evidence to support that with all that great data from the UK as well. So now the phase we're in now is we can be really confident and tell them, look, please go and get your booster. It's a really almost surefire way to stop you getting really sick. And that's the advice. And leave it at that then, you know, and just encourage people. My fear is half the people won't turn up because they feel they've been sold a bit of a pup, you know.
Yeah.
So how do, and my worry at the moment is, or my mission at the moment is to keep saying, please get the booster, because they work really well, and here's the evidence to support that.
And you see it constantly online, people saying, but people in ICU they've been vaccinated as well, and they don't understand. And I think there isn't something that's a simple sound bite. No. It would be great if there was, but I think you have to sort of take the time to explain to somebody, guess what, if there was 100 people and 90 of them are vaccinated and 10 of them are not vaccinated, and there's 10 people in ICU, 7 of those in some of our cases are the unvaccinated group, 3 are the vaccinated group. That means 1 in 30 of the vaccinated, that means 21 in 30 of the unvaccinated. And like, you got to do the maths, and if you don't do that, I'm sorry, I just did that in my head, those figures are roughly speaking right.
But if you lost me there.
But you see, but it means 20 times, broadly speaking, more likely to end up in ICU. Unvaccinated compared to vaccinated. But you've got to get that message out to people, because they don't understand, because they say, but I can still catch it. Yeah, you can. The transmissibility would have been nice if we were able to reduce transmission better with the vaccines. That would have been nice. We have reduced it a bit, but not as much, or not for as long as we would have liked. There's things that they didn't do. But think back to what Luke said at the beginning. It's a coronavirus. It's like the common cold gone mad. And we've never been able to become immune to that. This is no different. It's been a real struggle to have any level of immunity to this thing. Look at SARS, look at MERS, look at the other types of coronaviruses that we've had. This is a win. We have reduced our risk by like to a 20th of it would have been of being really seriously ill. We have to sell that to people. I will take that jab, the 3rd jab as it will be now for me, in my eyeball as soon as I can get it. They probably would prefer my arm, but I would take it as soon as I could get it, because that is going to be the game changer. And I'm only bullying that we didn't all get it a month ago before these cases were as high. They shouldn't have let 4,000 healthcare workers be either self-isolating or sick. We should never have gotten to that. And with respect to NIAC, who's full of very good people, move with a bit of alacrity. We were in the middle of a bloody pandemic. Like, you know, perfection is the enemy of the good. We need a bit of speed here. And that appears to be lacking in our experts as much as anything else.
So you mentioned there, Ciara, in terms of boosting, for example, the healthcare workers. Now, to me, the evidence was already there a long, long time before the decision was made.
Not just to you, to me, to anyone who looked at the evidence, it was already there.
So why do you think was there
I don't
a delay?
It's a mystery to me.
I think a lack of confidence, a lack of leadership, an abundance of caution that went into something sort of semi-pathological. I don't know what it was. I think there are a lot of personalities. You asked me about NPHET, and I will tell you my understanding of NPHET is that there are several tiers in NPHET, and some tiers are more influential than others, and they are not official tiers. They are just personality driven, and that's not to say anyone's doing anything wrong, but that is a slightly dysfunctional dynamic perhaps. You know, we need a bit of speed. We need a bit of assertiveness and kind of going, if we have the evidence that it's very unlikely to harm people to give them boosters, very likely to help them to give them boosters, what are we hanging around for? The balance is there.
I think there is a balance. I think NIAC have done a really good job in terms of making sure that people are absolutely confident that they're looking at all the data and making sure that what they recommend is, first of all,
It's like they're
is
not
safe.
under a time
But-
pressure here, and
yeah,
I don't, and
but-
that's a stupid thing.
But some of this has been very, and actually I really like, I think Karina Butler's done a fantastic
too.
job in terms of communicating, and but
Super
I
intelligent,
think
super
it would help
expert woman.
enormously in terms of coming out and even explain maybe the
Well, I think
delay
right-
in terms of some of the
But it is an
decision-making.
emergency again now, remember, because we're approaching Christmas, when there'll be loads of mixing and mingling and socialising going on. That's for definite. People will do that
When
anyway.
we'd like there to be loads of mingling.
Indeed, we
mixing,
would.
wouldn't
But-
We'd
but
actually
precisely,
like
yeah.
But if we've ended up in a present situation where I think 3,700 healthcare workers are isolating at the moment,
Yeah.
where a lot of that could have been prevented by earlier rollout boosters
That's
to
right.
that cohort, that to me doesn't make sense, and you have to ask, why was it not rolled out earlier?
And
But
this-
there doesn't seem within the
The same could be said of the
structure
age
that-
cohorts of the vaccinated who are in hospital now, that they aren't, there are relatively few of them who are in their 20s or whatever, they are the slightly older ones. They should have been boosted quicker too, and we wouldn't have the pressure on the healthcare service. We shouldn't only lean on restrictions to protect the healthcare service. We can protect the healthcare service by rolling out vaccines and using antigen
But yet,
tests.
Ciara, if you
and
ask
masks.
politicians in terms of what, to say, okay, we're obviously led by the advice of NIAM, there is no facility within the infrastructure. to
And that
be
is
able to
exactly what
quest-
Stephen Donnelly said to me last week. We'll wait for NIAC, and I said to him, our experts are leading from behind. Like that's not leadership when we're all saying to them, do it, do it, do it, and they're going, I'll get there eventually. Like it shouldn't be like that.
Yep.
Yeah.
I mean, what is the plan for the booster rollout, do we know, Paul? I know it's running, but how fast is it going to be?
Well, I think it's going to be recommended for the over 50s.
Yeah.
Over
It's been
50s, I think
recommended
that
for
would
the
be-
over 60s, it's been recommended for the over 16s with a medical infirmity of whatever
Yeah.
kind qualifies for it.
Yeah.
So that's that. We have an abundance of vaccines, we are no
Yeah.
shortage of vaccines, and we have an ability to deliver 700,000 of them in a week.
That's great.
So we have
That's
a
what we
huge
want.
ability. So that there's only 600,000 in the 50 to 59-year-olds.
Mm.
So we could actually do
Do
this,
them all
but
in a
we have,
week.
we have a bit of a backlog.
Are they going to reopen the Aviva in City West? That's what I would do, and get him in.
Yeah.
Get him in, get him through in a week.
Yeah.
It takes 7 days to kick in, remember. So as we get closer to this Christmas season,
Yeah.
it becomes even more important
And
to get
look,
it done
isn't that
by
the
then.
key point that I think we need to emphasise? With the booster, you get protection within a week.
Yeah, that's right.
So you're
Yeah.
looking at something, if you want to stop and break that link between all of these infections and hospitalisations, ICUs,
Yeah.
you have something that you know will work,
That's right.
and that will work within a week.
It'll work
So
better than
it's-
closing the nightclubs at midnight.
Well, yeah.
It's just- every time I think about
You know what I
that, it makes me laugh. I shouldn't be
It's definitely
laughing.
more effective.
I think so. There could be science
I was
behind that
driving here
somewhere.
earlier and I was going, this is just ridiculous. I was laughing away. Ha!
Yeah. But
It's
I
actually
think,
not
but I
funny.
hope they're going to do this, get the 700,000 done here.
That's my understanding of capacity. That's what they achieved in the
Yeah.
remember the massive rollout we all had
Yeah.
a few months ago. They were able to hit that level. They'd have to
Yeah.
ramp back up, but they can do that.
Yeah. You see, what strikes me, Paul, as well, based on our discussion tonight, people are probably going, this is interesting, and there's a bit of, we're knocking things here and there, which is appropriate. No, I think it's appropriate. Our discussion is very good. But the fact of the matter is, we know what to do. And we've always known what to do for months, and we just got to do it.
We've always been
Why
going
we
to,
haven't been doing it as quickly is a mystery to me.
we've always been going to boost.
Yeah.
We've always
Yeah.
been going to use antigen tests.
That's right.
And I don't know why we.
And I can give you, as a scientist, my word that I think this is the best way out of this period, is to boost quickly. Everybody over 50, everybody under 50 who's vulnerable, get it done within 2 weeks. That's better be my mission.
Yeah.
And then beyond that, then it's the odd bit of trimmings here and there. It's okay to have vaccines, passports, and so on. Antigen testing is good as well, but that's the big goal now. And I hope they're going to do it. I really do. And if they don't, we'll be telling them. In a sense. I mean, and then once we get to February, watch. Get to February. We now begin to go outdoors again. It's a seasonal virus that spreads indoors.
Sorry, I'm doing that because
Paul
the
has always
first
said.
person I ever heard say it was seasonal was Paul
Get
Moynihan.
to
I go, "It's
February, we'll
seasonal."
have 2 antivirals approved. Now, they're going to be a really important weapon on top of the vaccine campaign.
Yeah.
I saw today from Israel, that third shot will certainly give you 10 to 12 months protection, if not more. Right, they're saying. At a minimum, it's 10 months protection with the third shot. That gets us to next winter, okay? And then we give everybody a shot like the flu vaccine. And that's actually, I'm just giving you the way out of the whole pandemic. And that's going to happen,
Yeah.
I think. Now, what we know now. See, the thing is, it was like, what we know now, this is what I'm saying, in case you come back and you got it wrong.
But that's not wrong, because that's that's the best guess with the
Yeah, best
information
guess.
that we have. And I
Based
think
on the
you
data
mentioned
that
something
we've
about knocking things. That was another reason why reportage wasn't as good as it should have been, because anyone who knocked the government or knocked
jumped
the
on.
NEFIT
Yeah.
was put on the green jersey, would you not?
Well, if I may tell you two
what if the green
stories.
jersey is a bit speckledy and a bit beige? It's not actually green because we're getting something
This
wrong.
may
We weren't
be
allowed to
inappropriate,
say the
Sure,
challenge
didn't Philip
things.
himself come after me twice to criticise what I was saying? He emailed me when I criticised a couple of things, you see. So he's obviously watching. You see, now maybe he's doing his job and doing his best and all the rest of it, you know. But it was funny that any kind of knocking, or maybe knocking is too
It was
colloquial,
seen as
but any hint of
Team
breaking
Ireland,
ranks
yeah.
was seen as a negative, you know. And that's unfortunate, especially when it comes to science.
I think it's dangerous if the contrary view at least isn't considered, or there's a facility where
You get
it can
the
be
best from
raised.
science when you allow disruptors
Absolutely.
a voice, because disruptors challenge a narrative. And how else do you get evidence
And
when
the
you
reality-
challenge
No,
something
but
and create a
Ciara,
the reality is,
hypothesis?
Ciara,
Is that not the fundamental of
More
science?
times
No.
than not, we're wrong in science.
It doesn't matter.
You know, you come up with a
Well,
hypothesis, you do it, and actually
You're
it
wrong.
turns out
As
you're
Paul
wrong.
well knows, if there are disruptors there, you're sharper.
Yeah.
Because you know you're going to get kicked. Like when we go to conferences, right, in the good old days, I'd finish my presentation, very technical. There'd be 5 guys or women at the microphone digging into me. That was a stupid bit of data there. You didn't think of this
But that's
control.
how you
And I want
hone.
that, because
That's
I go,
how
you know,
you-
you're right, and
Yeah.
I'd talk to that person after, and I'd change my experiment. That's the nature of science. It's supposed to be disputational.
Suppressed the disruption,
Yeah,
and,
yeah.
and that was never good for the science,
Yeah.
and that therefore was never good for the outcome, I would argue. And as someone who is a natural disruptor, I found it kind of challenging myself, to be honest.
But I guess you're counterbalancing that with trying to keep the people with you, because if,
Yeah.
if the parents are bickering, the kids get scared.
Yeah.
So it's a funny balance, isn't it, in a sense?
Yeah.
But certainly behind closed doors, Paul,
Yeah.
NEFID and NIAC could have had a lot more scientists to do this, to put the needle in, and not in a nasty way, but just in an objective, sort of systematic way to help them, because
Yeah,
they
and I
want to
think
make the right
if you have
decisions.
advice, at least you should be able to, give the supporting arguments for it,
Yeah.
and be able to defend it. Ciara, we're coming close to the end, but I want to get your view on something sort of around the overall health system. So if you look at, I think most scientists agree this virus is not going away, it's going to be here.
Yeah, it's endemic now.
indefinitely.
It's here.
And for all of us, we're going to encounter this virus at some stage in our lifetimes, we're going to get infected with it. And really, in terms of individual outcome, really depends in terms of your state of protection at that stage, which for most of us, thankfully, if we've been vaccinated and boosted, we're going to be in a really good state. But we're getting to a situation where we're seeing it now, where our health system, even prior to COVID, it always seemed to be acting sort of in a knife edge during the winter months. And now, with this additional load, that's probably going to be on an annual basis, at least an annual basis, with COVID. So do you think there needs to be sort of a recalibration in terms of, you mentioned even ICU capacity, but does that really need to be looked at in a serious way? And
It's going to have to be looked at. And also, we have known for years that we've run our hospital system at 110% capacity. That is absolutely contrary to how it should be run, particularly from an infectivity point of view. You need to have it running,
Yeah.
some countries run it at 70, 80%, but we're 110, so it means you're all wedged in there together. That's never going to work. People were up in arms today. I think we were 489 people on trolleys in the country. We've been on 775 people on trolleys in the country before, pre-COVID. We had gotten used to a health service that wasn't functioning in a way that was good. And now we're more wary of it because we know that COVID has created a sort of a knife edge because of exponential growth largely, that it can just do that, it can just rock it. And therefore we can't, the flu can do that to some extent, a bad flu, and that's not to compare the two people who don't believe in COVID, say it's only a flu. The flu has killed up to 1,100 people in this country alone in any given year, on a bad year when there was a particularly virulent strain of the flu that was nasty. So the flu can do nasty things too, but we had become tolerant, I think, of having a substandard health service. And I think that now we have become not necessarily intolerant, but we have become wary of it because we recognise that if the health service isn't fit for purpose and we have something like we have now to deal with, the results of that are things like lockdowns, and that is an issue. So I think this has to change. But, and this is a really, really unpopular thing to say, we hear we've underfunded our health service. We had the Charlie Haughey years when we closed wards and we did all sorts of things we shouldn't have done. But if you look at our spend on health now in terms of OECD spend, it is not as bad as you might have been led to believe. Okay, our OECD comparative spend is relatively okay. Our health service still doesn't function properly, and that is because our health service needs radical reform. And as I say this as somebody who worked in the health service, a lot of the obstacles to reforming our health service come from the vested interests within our health service, whom are exhausted and are actually shooting themselves in the foot, by the way, as well, because one of the reasons it's all so dysfunctional, they actually are struggling to do their jobs because they are overworked and it is a mess, but also some of the resistance that they might have to certain work practices changing perpetuates some of the difficulties within the system. And you need some kind of massive reform of our health service. There's a reason they call it Angola, the Department of Health for Politicians, because they go in there and think that they're going to fix it, and it is dysfunctional, and then they don't fix it and they flounder, and all they want to do is get out as unscathed as they can. But we have a difficulty, and you would need probably two things to fix it. It's not just money. You would need a really big government majority, because to bring in sweeping change, you need to have a big government majority, because when you're on a knife edge and you're Fianna Fáil and you're Fine Gael and you've got Sinn Féin over here literally chomping at your heels, you're in a very vulnerable position. So there's a difficulty. You need a big government majority, and you would need public sector union buy-in, which unless you throw money at that, it doesn't seem to work. So you would either need somebody with such deep pockets that we'd get no value for money, or somebody to face down the public sector unions. And that's not to say people haven't a right to unionise, and I don't particularly have a right-wing bent about unions, but I dislike public services not being run for the sake of the public. I don't think that, I think socialism without a social conscience is no use to any of us. So I believe that public services, health and education, and all those really big important ones should be run for the benefit of patients and children who are going to school. I don't believe they should be run for the benefit of anybody else. And I think we have a real difficulty tackling the reform that is needed of the health service, and it is really, really needed, because factually the OECD level of spending that we have in Ireland on health is not, no matter what you have heard, is not very much less than anywhere else, but we don't have the same outcomes.
That is the problem. We're going to finish on a positive note. Something you've mentioned a couple of times are the antivirals. I think they're really, really, really important in terms of helping us to control this. So again, if you look at vaccines, they're 80-90% effective in terms of protecting against serious illness. Put on top of that now, these antivirals, some of the antivirals that are coming out now, with 90% protection from hospitalisation. So can you just give some sense in terms of how important those are?
I'll give you the scenario now that will happen with these antivirals. Now again, with the caveats that they've only been on clinical trials, but the numbers are good. So you might be vaccinated or not, you might develop a sniffle, and then as long as you get tested within a day or two, the antiviral will kill the virus in your body and be gone. That's what the data is telling us. So that's really important. The challenge is to get quick diagnosis. They'll probably work within 2 to 3 days of symptoms beginning, So you need to know, an antigen test will do the trick probably. Yeah. You'll need to know. Now maybe if they're really safe, they could be taken with any sniffles. And guess what? They're going to work against other coronaviruses. So it'll be at last a cure for the common cold. Yeah. So that's the scenario we're going to face into now. The only question we don't know is if they'll work in vaccinated people, strangely, because there was a trial done on one of them and it didn't work as well in vaccinated people for some unknown reason. That was a small trial, so we don't know. So there's a few unknowns. The other unknown is, will there be any side effects? Because once you go into 100,000 people, you might get a hint of that. Yeah. But given the experience we've had with protease inhibitors from HIV and hepatitis C, and given that there's reverse transcriptase inhibitor HIV, they're pretty safe drugs, and they're chronic diseases, and they use them in those. This is an acute disease, so we can be optimistic that there shouldn't be a safety profile. So at the moment, we will have vaccination to protect the vulnerable. We're not going to keep vaccinating the whole country every year. That's ridiculous. It'll just be like the flu. If you're vulnerable, you'll take a vaccine every winter with the flu shot probably. Everybody else develop symptoms, pop an antiviral, and it'll kill the virus. That's what the future looks like, and we've got reasons to support that through the data we have in front of us. So you can't overestimate the importance of antivirals. And remember, there's about 3 more coming down the track. AstraZeneca have one, and so Roche, that are just as good. Now we haven't seen the data, but they're the same kind of class of drug. Remdesivir, the very first one, you may have heard of that one, that's an injectable drug, which makes it difficult to give because you've got to give it in hospital. They've made an orally active version now. It worked great in an animal model of COVID. It killed the virus in the animals beautifully, orally given to the animals. So they'll probably have 5 or 6 antivirals in the end. It'll be a case of then marketing and price and those things will come into it. So I do see the antivirals as the really important development that's happened in the past.
I think they're a great example as well. Look, we started off in terms of the importance of science. So for example, if you look at the most effective one, Paxlovid from Pfizer, that was the first drug used to target something specifically
Yeah.
in this virus. But it was based on data from 2003 for the first SARS coronavirus. And there was a paper back in 2003, and Pfizer actually used that as the basis for their, and that was basic research. So I think
Yeah.
it's a really great example in terms of the importance.
And what's
of
tremendous
science.
is we know exactly how they work, these drugs. So when the virus is making a copy of itself, it packages the proteins in a certain way. You need to think on a protease to do that. If you block the protease, the virus falls apart. That's a wonderful way to disassemble the whole virus. In the case of the transcriptase, when the virus makes a copy of its recipe, this drug introduces errors into that, and you get a recipe doesn't work, and again the virus dies. You see, so it's really fantastic science. It's not discussing things like mask wearing or whatever it might be. That's why we love this, because we can be definitive. See, Paul and I are only happy when we can claim something with scientific evidence behind it, right, Paul? So what we say there, we're happy to say that, because it's great science that supports what I was just saying.
But can I say one last thing, sitting here between the two of you? I mean, there's been a lot of people have been quite heroic, people like in the first wave without adequate PPE going in and treating patients in ICU who are like just secreting COVID all over the place. Like there has been real heroics, but the battle against COVID has been fought and won for us by science and by scientists in labs with test tubes working around the clock, and for all the shtick that pharma and all that gets, it is science that will defeat this, and a little bit of time, and we will get through this.
Yeah, my closing line in my book is as follows. I say it's through scientific ingenuity and care for each other we'll see the back of this pandemic. And it's both things, And the Irish people have been very good at caring for each other through this overall, I think, in all kinds of ways, And you've ingenious science going on at the same time. Both of those are the way to stop this pandemic, and that's going to happen. It's just a matter of when. And in the next 2 months, can we make sure that this doesn't go off the rails, and that we end up with a lot more people in hospital and all the awfulness that would have happened last January, for instance. And we know what to do to stop that. So I'm very, I would say optimism is my trait, but it's true. I mean, if they make a hames of it, and Ciara would know this as well, are they going to make a hames of it, Ciara, or not, the next 3, 4, 5 weeks?
No, but we've missed a couple of tricks. We should have moved quicker on boosters. We should have moved quicker on antigen testing. I still think that we should change to the N95 masks and mandate them. I think if we did those 3 things and, maintained the bit of social distancing and all that crack, then we could live an almost normal life and not end up in chaos and pandemonium. We have been slow on a couple of things there, so it's a little bit of I don't know where we're going, actually. But
Like I'm hoping the Taoiseach banged on the table today and said, get the boosters out, for crying out loud. Get the antigen, I even given them his thumbs up, get them out now, quick, come on, you people, just go on. If it was Charlie Haughey, you probably did it.
We still aren't ambitious enough with what we're going to do with the antigen test, in my view. Even what they've said today,
it's wishy-washy.
It's twice, go and buy them, we might subsidise them a bit, and twice a week. A lot of people don't even know how to use them, we could...
My wife was very happy with me because I was on Clareburn doing a demo of an antigen test as opposed to washing down shopping, which I was doing like 9 months ago.
Which was
you've got a PhD, Luke. What the hell? You're washing shopping for the Irish people. It's ridiculous. I was actually, this is an antigen. This is a buffer. It was great, so much better.
Putting the white coat on.
Yeah.
Before thanking Ciara and Luke, does anybody have any pressing questions or a question that you always wanted to ask, or does anybody have anything?
You're making us look bad now, to be perfectly honest.
You've got us here now. We'll answer anything.
We're not leaving until someone asks us.
Yeah, absolutely.
Two parts. Do you think we're any closer to knowing the origin of this coronavirus? And is the world a better place to deal with the next pandemic? Because there will be a next pandemic.
No, we're no closer at all, and we'll never find out. We know it came from a bat. There's 2 options: a bat in the wild, someone was shoving in guano or whatever, right? Or a lab accident. They're the 2 options, I think, that are most likely. It could be either one, so we just don't know is the sad truth of it, and we're unlikely to find out. Now, in terms of the next one, there's loads of coronaviruses in bats. There's a woman in my lab at the moment, Emma Teeling, who's one of the world's bat experts, actually, Emma, and she's on sabbatical in my lab, and I have terrifying conversations with her about the number of coronaviruses. So there's always, and the bats tolerate them, interestingly, so they're like, they live in the bats quite happily. So any one of those could jump. Now, you would hope that this was a rare event. The most likely scenario, we think, was it was someone who was immunosuppressed, who took up a huge dose of virus and it began growing in their body. you know. And then they went home and infected their wives, and then next thing it starts to spread. So it's a bit like Titanic, you know, 5 things have to go wrong. So it's hard to predict it happening again. But the good news is we'll know what to do next time, hopefully, won't we, you know? And we should act very fast next time to stop this happening again, I'd hope, anyway.
Yeah.
I'm just wondering, what are your thoughts on global vaccination program and the fact that we're talking really about having our third booster, and there's some developing countries that may not have had their first shot yet. I'm just wondering what your thoughts are.
Yeah.
You're absolutely right. Vaccine equity doesn't exist, but unfortunately, health equity doesn't exist. So if you are someone who's growing up in Zambia, you don't have the same access to healthcare that you do in the Western world. Europe hasn't been too bad compared to a lot of wealthy countries. I think we've sent over 200 million vaccines to the developing world, and Ireland has sent 1 or 2 million, and also the Irish people, not the Irish state, but the Irish people, through UNICEF, through the Get a Vaccine, Give a Vaccine programme, have donated over 1 million vaccines. So we've punched above our weight. Now, that's not to make an excuse. You are right, it's not fair. But equally, we have to sort of deal with the situation that we have, and Ireland can't save the developing world on its own. And also, truthfully, because particularly now vaccine production is bigger and broader, it isn't just the fact that Western countries are using vaccines that's stopping the developing world from getting them. There are other issues too to do with logistics and corruption and all kinds of things that are beyond, unfortunately, our control. I agree with what I think you're saying is that it's not fair. It isn't fair. But it's also not fair that I can go home and eat whatever I want out of my fridge and some people have no food. I think what we probably need to do is sort out Ireland and do what we can as well for the developing world. But I don't think it's going to be realistically an either or that we won't do stuff here until, and I know that the WHO are very much their remit is global health, but I suppose our government's remit is Irish health and then doing what we can for other nations. And there's far more to health inequity than just the COVID vaccine, you know. Perversely, in some ways, poverty has helped a lot of countries because of quite robust immune systems, because of poor sanitation, because of shortened life expectancy in those countries. Younger populations fight it off. So actually it's all very odd when you look at the demographics, but is it fair? No, it's not fair at all. You're quite right.
I think of that, I think booster programs should be targeted rather than mass booster programs. And the reason why I say that is that I think the vaccines, the 2-dose vaccines that we've used so far are still working incredibly well in protecting against hospitalisation and serious illness. I think if you look at the groups who are ending up in hospital now, there's 2 groups. There's the unvaccinated, even though it's still a small proportion, there's what, 92% of the adult population. There's unvaccinated. Some of the vaccinated ones, they're still associated with those risk factors that have always been associated with developing severe COVID. But if you look at other groups, like younger age groups, they're not ending up in hospital because the vaccines continue to work. Yeah. So I think, you know, this looking at the risk factors, primarily age, but also other risk factors, obesity, diabetes, metabolic health. So I think targeted booster programs, but I think there's a real need in terms of a more equitable distribution. Various alliances, for example, the COVAX alliance has been set up to allow for that equitable and timely distribution. But that hasn't really delivered, and one of the reasons is that, you know, high-income countries are going in and competing against COVAX for purchasing the vaccines, and this has led to, I saw some figure there over the last number of months, for high-income countries, they've given more boosters than the poorer countries have given over the entire pandemic, with some of these countries having single-digit vaccinations, where you have people there, vulnerable people, if they don't get a vaccine, they're going to die. And Mike Ryan, WHO, he came up with, I think, was a fantastic analogy. Many of us have, at sea, we've 2 life jackets, and then you're looking for a 3rd life jacket when there are others out there with none. And I think that was a brilliant way of capturing it. So I think a booster program, absolutely, but targeted. That would be just my own opinion. I'm not sure, Luke.
We can target because it's such a discrimination virus. It discriminates between health issues, between age, it's very much a discriminatory virus.
It makes your heart sink to see the level of vaccination in those countries. Absolutely, it's horrendous. I mean, one argument I heard recently, Paul might correct me if I get the numbers wrong, but like to say it's a benign disease in children, so the sharp end of this is going to be, do we vaccinate the kids actually, because it's a very mild disease, as we know. Yeah. Well, so that debate is very live on this topic, because to save one child's life, you vaccinate 100,000 children, right? If you're over 80, you vaccinate 80 people to save a life. Now, you can see where the vaccine should go there immediately, not to the children. It's just unethical, you know. But it's going to be very hard to get that debate, isn't it? I don't know where we're going to go with the
the only
children.
argument for vaccinating children is to prevent them being a reservoir that
Yeah.
could cross-infect us. That's the thing. But also, there's also an argument that perhaps for the children themselves individually, it's equivocal whether or not the risk from the vaccine outweighs the benefit. So it's not necessarily good for the children. It's not necessarily good for the over 80s and other
Yep.
countries. So there's loads of debate around children, and there is a tipping point where risk and benefit and vaccine and age, that tipping point is different at every age.
I would lean towards not vaccinating the children, actually, as long as the vulnerable are boosted, for example, you know. But I don't know. What do you think, Paul? It's a hard one, isn't it?
Yeah, I think it is. Like, the benefit of risk obviously decreases, you know,
Yeah,
with
the
the
younger you
younger
get.
age.
Yeah.
I mean, like, if you look at the US, and the FDA have approved for vaccination from 5 to 11-year-olds. And the decision there was unanimous with the advisory committee to the FDA. And they basically judged it based on, is there a benefit for the children? And the US, like, it's not the fact that no children are affected. I think there have been about 500-600 deaths in the US of children. Thankfully, none here in Ireland. So they made a decision, actually, yeah, it does protect, but there is that ethical argument
very
to
hard.
consider in
Yeah.
terms of.
Youngest death we've had here was a 14-year-old, and
Yeah.
that's a tragedy for
Yeah.
any family. There's no question about it. But as you say, it's that rate of vaccinating 100,000
Yeah.
to save one versus vaccinating 80 to save
Yeah.
one. There's
That's
obviously a
the-
much
that's
greater bang
the crux.
for your buck with the vaccine in other groups, and like we said, it's not simple.
Any final question? Yep. One at the back. Yep.
Kind of on that, do you think that like it's kind of difficult to argue against the sort of conspiratorial arguments because some of their points are true, like wrapped in the kind of lizard people, running the world, but like about pharmaceutical companies, like their vaccine patents actually do quite like create quite a lot of issues for developing nations to actually produce their own vaccines. And do you think that, well, first of all, like a comment, would you comment on that, the fact that like patent laws are so stringent and so detrimental to developing countries, not just for, well, obviously within this talk it's relevant just for talking about vaccines, but for things in general, the development in general, patent laws are so stringent, but also then trying to discuss with people who are sort of conspiratorially minded in these issues.
Yeah, it doesn't help. It doesn't help the argument. You see, is the first thing, you know.
Yeah, there is a point there that they wrap kind of lunacy around.
Oh no, it is. It adds fuel to the fire, basically. That argument. I mean, Merck are a great example of a company that's more ethical, whereby they're going to allow countries to make molnupiravir without royalties coming to them. That's a really good development because that means, and they're easy to make those antivirals. That's great to see that. Pfizer are in similar negotiations as well. With the vaccines, you'd love it to be easily made in any country, really. That's got to be the goal. Now, the reason why they won't give up on the patents is a complicated one. I don't think it's as straightforward as it seems either, by the way. You know? But I would definitely be of the view that equity is about allowing any country access to these vaccines and allowing them to produce it locally. You can make it in India, you can make it in Brazil, these vaccines. The drug companies say it's very difficult to set up a factory to make it with the right stringent regulations. That's true. It's not like making a tablet, so it's a complicated question, actually. It's another tricky one.
Yeah, I think there is an onus on the pharmaceutical to step up to the plate. So,
Yeah.
for example, if you look at it with the vaccine development, one of the reasons why the vaccine development was so quick was because of the resources that were pumped into it. And it was de-risked. So normally as part of the process, there'd be a phase 1, phase 2, phase 3. The company would not progress from phase 1 to phase 2 unless it had the data to show that actually this worked. There's a major investment required. I would not go to large-scale manufacturing until it was shown that it actually worked. Whereas here, these companies were supported by many governments to de-risk that even in the absence of data, knowing that these were going to work, they were already being manufactured in large quantities. And some of the companies, for example, AstraZeneca tends to get a bad press, but in terms of the cost per vaccine, it's probably 1/10, 1/15, for example, of the cost of the vaccine from Pfizer. If you look at Pfizer now, for example, the antiviral that you mentioned, Luke, Paxlovid, which I think is going to be enormously impactful, but it'll probably be a 5-day treatment, but they're going to charge like €700 for that treatment. So I think the questions have to be asked there in terms of profiteering and exploiting that situation. So I think there is an onus on pharmaceutical companies to step up to the criteria.
It's a very complicated business question as
Yeah.
well, I remember, because I think something like 50% of all pension funds are invested in drug companies. If they don't make a profit, you don't get your pension. You know, it's a very complicated ecosystem the way these drug companies are embedded in our society. You know, so it's good if they make a profit because then you're going to get your pension paid. Kind of, that's part of the argument. Now, but I agree. I think they need to do more, and certainly there's been awful examples of gouging and all that kind of thing as well. So
they would argue that their R&D costs
Yeah.
them so much
Yeah.
that they have to have patents, and that may be true outside of the pandemic.
Yeah.
And I think that they are using that to some extent to allow them to behave this way within the pandemic.
Yeah, it does take a drug company to deliver on these vaccines. It's a very complicated thing to do, involving huge resources, huge staff. To run that 40,000 patient trial took Pfizer a huge amount of investment, right? They wouldn't have done it unless the government de-risked it for them. They wouldn't have done it because it's going to cost us a lot of money, and it mightn't work. And we've blown all that money. We're a business, So it's a really good question to ask, and I bet there'll be PhD theses about this, And it could change pharma. My dream here would be the pharmaceutical sector might change because of this in a way. Like, why don't governments subsidise research into Alzheimer's in this way or Parkinson's and get drugs quickly through that mechanism? And there'll be long-term benefits there as well.
Because they don't care about that as much, and
It's the emergency.
That's
Yeah,
part.
that's true.
There's so many of us affected by COVID, and there's so many ramifications from COVID in terms of life and economies and all of that they were really motivated to sort out COVID in a way that they aren't around things like Parkinson's, unfortunately, and Alzheimer's.
Do we have another question there from the middle? Yeah.
No, that was my question really. It was like, if you would have to wonder if the resources were put into the same amount of resources that was put into developing this vaccine was put into other diseases. What are your thoughts on, what other diseases could be tackled? Could they be better tackled?
Well, even though we said it was difficult to make the vaccines, they knew what to do there in a way, Parkinson's is a very difficult disease mechanistically in terms of what do you target, what do you go after. The trials take 3, 4, 5 years to run because of the nature of that disease, So there's some challenging diseases there. But what this COVID pharma axis tells us, if they're allowed to de-risk the programs, they're more enthusiastic going after them, And that might be the lesson from all of this. And the big diseases confronting us are these diseases like Parkinson's and Alzheimer's. We've got an ageing population, they're devastating diseases, there's almost nothing for them, So there are two to focus on, I think. And then the third is cancer, of course. Now, there's great progress there through the immune system, as you might know. So in other words, more effort around that could really make an impact. And in fact, that's a more straightforward one to go after than Parkinson's and Alzheimer's, because again, we kind of know what to do with cancer now.
And COVID, with the mRNA stuff, which is also being looked at for things like cancer, may actually spawn other treatments now for other things.
Yeah.
So there may be positive knock-ons down the line.
There's a big vaccine against
hope.
HIV in development at the moment that uses the RNA technology. So we may get a vaccine for AIDS out of this because of what we've learned from COVID, which would be great. But that's your low-hanging fruit, in my opinion, because we know RNA vaccines work. Deploy them now against malaria, HIV, TB, they're the three big ones. And again, you'd have grounds for optimism because vaccines kind of work against some of those already. And now we have a supercharged technology to beat those ones. And if we got a vaccine for malaria, that would affect the developing world like nothing ever, because it would be hugely impactful.
I think another enormously important area is the area of antibiotic resistance. When you speak about potentially future pandemics, and people tend to think of viruses, but I think antibiotic resistance is an area that's really underfunded. Pharmaceutical companies, it's not very profitable. I think, in my view, there needs to be enormous investment put into that, because I think that's a real risk. There are some microbes out there, some bacteria there. We're sort of almost reaching limits in terms of antibiotics that actually work.
We've taken antibiotics for granted.
Absolutely.
People used to cut their finger and die, do you know what I mean, because they got sepsis, and we don't get that anymore. People used to be terrified of getting a sore throat because they might die.
This is what's galling about the negativity and conspiracy theory about this. Vaccines and antibiotics are the biggest contribution to human health ever, both of those technologies.
Yeah.
So how they can be denied is a mystery to me. It's just huge, in fact. The analogy I've often given is in 1951, if a child turned up in a GP surgery with polio, they got paralysed, Now, the vaccine, no paralysis from polio. It really is black and white, and there's loads of examples of that.
I felt that very much when they rolled out the HPV vaccine, that we had a vaccine against cancer.
Yeah.
Like, it was like the Holy Grail, do you know what I mean? We had a vaccine against cancer, and it's not just cervical cancer, it's lots of genital cancers, but it's also head and neck cancers. And yet, that vaccine came far closer to failing than you might imagine. I don't mean failing in terms of its efficacy, failing in terms of when you roll out a vaccination program, unless you have a certain uptake of the vaccine, it no longer really is fit for purpose. And 50%, if you fall below 50%, the cost of running the vaccination program sort of outweighs the benefits that you're going to get. And we were cruising around, and I don't know if it was common knowledge, but we were cruising around 48, 49% because of the massive anti-vax campaign against the HPV vaccine. And hundreds and hundreds and hundreds of lives would have been lost. We were very close to that vaccine failing in terms of being rejected by the population, even though it is a very good vaccine. And, you know, I except for it wasn't available when I was young, I would have taken it, and I've given it to my children, and I would give it to, you know, that was like watching the holy grail of medicine being destroyed by conspiracy theories and misinformation, which was dreadful, but obviously it has survived, and it is a good thing.
Okay, any final? Okay, yeah.
Maybe about beyond your area, but has any emerging psychological research, I guess, on how to combat that kind of anti-vax, anti-reason? It's obviously a huge problem, but...
I hope so. Yeah, I mean, in fact, there's a great opportunity for psychologists to look at this, isn't it, and say what has gone wrong or what's been listened to and what hasn't. And I think the social media bit's really important, because we should surely learn from this whole pandemic about how social media should be managed, you see. So, but I'm not a psychologist, I don't know, but I imagine there must be lots of research.
David Robert Grimes, who is a cancer researcher and a physicist, has a book called The Irrational Ape. If you are interested in this, I'm not just selling this book or anything, but it's a whole book on how to challenge conspiracy theories. And it's a bit like what you said, the bit of shit in the swimming pool is the bone. The perception of threat, we are sort of evolutionarily programmed to overreact to threat. And people who believe in conspiracy theories believe that there is a threat out there that everyone else is missing. And there's also a little bit of maybe narcissism and things thrown in where people think, I'm the only person who sees it. I can change all of this and all that sort of stuff. So there's loads of things feeding into it. It's a really interesting book if you are interested in it, The Irrational Ape. And it's well worth a read because it's very entertaining as well, but it's very science-based, but it looks at all those rabbit holes people go down.
I think when you look at vaccine hesitancy, it splits into two groups. There are groups who are certainly completely against vaccines, period.
Yeah.
But then there are others who have concerns, anxieties, and you know, the questions to ask. And I think it's right that they're sceptical. And I think we're all sceptical in the sense that when I was asked early on, you know, will you take the vaccine? I said, well, I'm going to wait to see the data. I'm going to wait to see if it's safe. So at that stage, skepticism is okay, and then you look at the data and then you say, yes, okay, I'm happy with this. But
I thought you were a believer, Paul. You took it at face value, you know, without looking at the answer. You know,
it's like an act of faith.
Yeah, an act of faith.
But when you look at the disinformation, then you go from skepticism to cynicism, essentially. And that's what needs to be called out, I think. And,
you're right, there is hesitancy, and then there's anti-vax. I didn't vaccinate I have a 12-year-old son and a 15-year-old son. I didn't vaccinate them till the vaccine was available for it must have been nearly 2 months, because I was looking at the studies on the myocarditis in the teenage boys, and I am a very pro-vaccine person, and I have not remotely, but I was looking at evidence, and I was going, okay, I know we're all just piling in on this one, but I'm going to wait and have a little look at what's happening with the side effects in their age group, because I wasn't particularly worried about them getting COVID. I waited a little bit of time, saw some more evidence, got them vaccinated. That's not an unreasonable thing to do. Didn't say that publicly anywhere at the time because I thought I better not undermine the vaccine program. But I think watching evidence coming in is
and one group was pregnant women. It was very understandable they'd be very hesitant and worrying about their...
They always are more hesitant,
and
which doesn't mean they're anti-vax.
And all that you could do there was reassure them. There was data coming out, and like the Royal College of Obstetrics made a very clear statement. That helps. You know? I think another factor in this, I think, is tribalism. So I'm in a tribe. I'm in the immunology tribe. So take what I say with that in mind. But if you're in a tribe that's anti-vax, it's very hard to get out of the tribe, you know. And you're caught in that, and it's a support group for you. And there's vulnerabilities in these people as well, remember. It isn't all malignant, you know. So it's a mix of motivations, I think, is going to...
So we'll take one last question. Was there one there in the middle? Yep, one last.
I was just wondering, would you think it'd be worth it to invest in implementing like educational programs about making vaccine or understanding vaccines more accessible to other people, especially since social media is used widely right now? I just think that it would be like, in my opinion, I think it would be worth it considering once they got that information from younger age, let's take that into when they're older and then it'd be more like acceptable taking the vaccine.
I think Ciara said it earlier, it starts in primary school. And what you're really trying to teach people or inform those kids of is how to tell what's real and not. You know, it starts with that. Trust the information or not, look for good sources. There's ways to do it, you know. And then once you get specifically on vaccines, absolutely, it'd be great to do something on using very sort of robust methodologies to explain vaccines to people in a way. There is stuff there. It's hard to follow. I find it tough myself sometimes, you know. But there are, maybe that's a job for you. I'd love to see a really simple, but not dumbing it down too much either.
The platforms have launched. You know, I actually posted tonight on social media that we were doing this, and immediately Instagram slapped a COVID kind of warning onto it, going, you know, go to a trusted source. And I felt like saying, "You're a fucking trusted source. What are you talking about? Do you know who's in this room?"
Yeah.
But like, so they are doing that now, because I don't know if you remember 2 years ago, you could actually say anything you wanted. Vaccines will make your hair turn green, and Facebook or none of them would chat. That's fine by us. Yeah. So we are, like, we're only learning about social media. Do you know what I mean? It's a new phenomenon. It hasn't been around very long, and we're grappling it. And up until relatively recently, none of the rules of the real world were being applied to it. I think that's changing. I think they're now being viewed much more like publishers, which do have rules, and I think they're being viewed much more like as having potential for harm, and maybe sometimes even malign, never mind pharma companies, social media companies, having maybe, you know, they just want to harvest new recruits, and they don't care, and, you know, they want to keep them online for longer because they are the product and the advertisers love it and all that. So I think we're only coming to terms with the beast that is the internet, and I suspect over the next 10 years how we allow it to behave will become more regulated and change, and maybe, yes, information will have to be somehow a little bit more factually checked before it's just blasted out into the ether, and I think that would be a good thing.
I saw a great thing recently. It isn't to do with vaccines, but I chaired a committee for the Royal Society, which is the very eminent thing in the UK. They showed me how not to be biased. There was a video as a chairperson. It was fantastic, you know, unconscious bias, done in a very simple way. And I thought everybody should see this video, really. So there are ways to do this, and we need.
Is this the blue-eye brown?
Clever. Partly that yeah. But it was really good. Like, I didn't realise I was chairing the meeting, you see. And it was telling me, don't you be just listening to the men. You know, this kind of thing. Not in so many words. But it was done. And it turns out in a meeting, men nod more to the chairperson than a woman would. And then the chairman's drawn to the nodding person. This kind
that's
of thing,
the only
so
reason.
watch for that sort of stuff. So watch for that kind of thing.
It's just like Ciara disagrees with you.
That's right. Yeah. Ciara was nodding away there when I was saying that. But no, I think your suggestion is a great one. I think we need better ways to convey this stuff to teenagers in particular, probably, you know, and whatever ideas you've got, bring them forward.
This is all new. We're grappling with the pandemic. We're grappling with ways of communication that didn't even exist 20 years ago. You know, like, broadly speaking, they might have existed in some anorak's computer, but they didn't exist in most people's pockets at the end of their arm and all that stuff. So we're grappling with an awful lot of change. It's very dynamic. I think we're winning on all fronts, but that just could be because I'd like to end on an optimistic note.
Well, one thing that I would say is when the haters began, I've got lots of haters now, it's great, you know, when they began coming at me, my son Sam, who's 21, he says, Dad, he said, Dad, I've seen all this hate against you. And I'm thinking he's upset. He said, not that you've made it. So that was good. You know?
That's your index. Luke, Ciara, thanks a lot. Thanks a lot for coming out to visit us. Really enjoyed it. Really enjoyed getting your views on various COVID-related topics, putting your head above the parapet, and obviously we're going to be shot at. But I think it's really important. And as you said, Ciara, I think we just touched and discussed some things here that maybe weren't discussed previously in detail. So thanks very much. Ronan, I'm not sure if you wanted to have any parting words.
No, I think this has been truly an interesting meeting, discussion. I think there are some things that kind of have been bravely raised. So I truly do thank you for your frank discussion today. And I just would like, on behalf of everyone here, really do appreciate you coming out to the university. So thank you very much.